Hi guys, today I'm going to share with you some tips that you need to know before you sit for the OSCE, especially some common mistakes candidates make. So if today is your first time meeting my video or coming to this page, please make sure you follow, like and share, and you can also make a comment. Okay. So today we are going to talk about some common mistakes candidates make in OSCE. And today I'm going to touch on when it comes to implementation. Okay. So with implementation, examiners are looking for one particular mistake that is common among candidates. And once you make that mistake, it's a straight fail. This one thing I say, and people say, why do I have to say it's a straight fail? Yes, it's a fail. And that mistake is one, if candidate fails to check the expiry dates of the medications. Okay, so medication is the main product or item you are going to use when it comes to the implementation station in OSCE. Mind you, we all know that implementation station in OSCE is administration of what oral medication to the patient. So during administration, one thing you need to look out for is the expiry date of the medication. It's very important. In OSCE, when you pick the medication from the medication trolley, okay, the medication has a label, and on the label it has the name of the medication, the expiry date of the medication, the strength in which the medication comes with, and then the batch number of the medication. So you need to verbalize these four things and also make sure that you verbalize that the medication is safe for you to give to your patient. Failure to do so means you are planning to fail this implementation stage. The second one is when candidate fails to interpret the medication prescription very well. This means that you have to read the prescription very well and verbalize all the 10 rights of medication administration. So if you fail to verbalize all the 10 rights of medication administration in OSCE, it means you are planning to fail as well. So this is how you need to go about it. You have to read the prescription, make sure that you mention every element or every component of the prescription, the dose, the frequency, the indication, whether there is what prescriber's signature and blip number, whether there is prescriber's print name, the time of administration. Everything need to be covered. Once you are doing that, on the prescription there will be the route for the medication. After verbalizing all these or reading the prescription thoroughly, you might have covered all the 10 rights of what medication administration. The third common mistake candidates make is overdosing the patient or underdosing the patient. One thing as a nurse that is critical in medication administration station is giving the right dose. In OSCE, in the event of pressure or in the event of heat, candidates are not able to read the prescription well and in return fail to recognize or get to know the required dose to be given to the patient. For instance, in insulin administration, many candidates fail because they withdraw more or less of the insulin according to the medication prescription. When it comes to tablets, there are some tablets that comes in different strengths. For instance, levothyroxine for hypothyroidism in OSCE administration, okay, comes in various strengths: 25 microgram, 50 microgram, and 100 microgram. So if the patient is being prescribed for 100 microgram of that tablet, and the strength in which it comes in the container is 25 microgram, it means you are going to take 4 tablets of the 25 microgram of the medication and administer to the patient. In the heat of that, candidates either fail to give the required number of tablets that will be given to the patient, and that is an underdose. And sometimes people also go beyond the line and give overdose of the medication because they did not read the prescription well, taking into consideration the dose of the medication. It is also very important. Once you give an underdose or overdose of medication to your patient in OSCE, it's a straight fail. Nothing can save you. The next thing that I'm always particular about whenever I'm teaching is not signing the medication administration before giving the tablet. That's why I always advocate that in OSCE implementation, do not touch your pen. Don't touch your pen. Make sure that all tablets that are due your time are given to the patient. Patient has swallowed the tablet before you touch your pen to do all the necessary what documentation. So I advise all candidates taking the exam that in every medication administration station in OSCE, make sure you finish with the task or the procedure. Make sure your patient has received the medications before you touch your pen to do your documentation. The rationale is that once you touch your pen at the beginning of the station, it is considered unsafe because it's termed as what? Signing the medication prescription before giving the medication. So I advise that make sure you've done all the necessary things. Patient has received the tablet before you what? Touch your pen to do your documentation when it comes to implementation station in OSCE. So these are four out of the numerous what mistakes people make when it comes to the implementation. Make sure you don't fall a victim. Read your prescription well. Thank you.